morning. I'm Molly Gamble, Vice President of Editorial at Becker's Healthcare and Editor-in-Chief of Becker's Hospital Review. Every important decision hospital executives make typically comes after they've looked at the data. So when it comes to process improvements and effective change management, the same should apply. You need to leverage actionable data, but how and where we gather it often varies. We've seen that when hospitals don't have a designated data analyst who can pull data for robotics program, they don't get the information they need to benchmark and measure their programs compared to hospitals that do have a designated data analyst. This ends up preventing truly effective change management strategies. This morning, we brought together a panel of experts from hospitals and health systems across the country to talk about their own experiences in utilizing actionable data for effective care team coordination in their robotic service lines. Let's start by having the panelists introduce themselves and briefly comment on their own programs at a high level. John, let me ask you to start us off this morning.
Great, Molly. Thank you. And thanks for having me. It's an honor to be part of this panel. So my name is John Phillips. I'm the president of Methodist Dallas Medical Center in Dallas, Texas. We've been on our robotics journey with our robotics service line for about 11 years now. Time has flown. Methodist Dallas is part of Methodist Health System of Dallas, Texas, and we have 10 hospitals throughout our system. Methodist Dallas, where I am, we are the urban downtown level 1 trauma center hospital with a teaching program of about 5 specialties, general surgery teaching program, which robotics is a big part of at our hospital. And we are currently have 4 XI robots at our hospital, stay very busy as a robotics organization and really see our robotic service program as a service line that has been embraced by multiple specialties. So it didn't necessarily start that way, and I'll talk about that probably a little bit later, but honored to be here today.
Thank you so much, John. We're glad to have you with us as well. Matt, can I turn it over to you to go next?
Yeah, thanks, Molly, and appreciate you having me here. My name is Matt HASBROUCK. I'm the Chief Operating Officer here at Memorial Health University Medical Center in Savannah, Georgia. I've been here for a little over 2.5 years now, going on 3, and I'm excited to be here. Very proud of the program that we've put together. Our journey started about 3 years ago, and we started with an SI, and as of today, we have 4 machines. 3 of those are XIs. One of those is the latest SP single port. And we have grown our volume in this area 4-fold over the last 3 years. And really using data to really help us in decision making and certainly execution of our program and delivering tremendous results. So excited to talk to you about it today. And thanks again.
Looking forward to hearing your story more so in the conversation to come. Susan, let me turn it over to you.
Hello, my name's Susan McDonald. I'm the Chief Nursing Officer at St. Elizabeth Healthcare in Northern Kentucky, just south of Cincinnati, Ohio. Our healthcare system consists of 2 surgery centers, 4 hospitals, large multi-specialty physician group, and several ambulatory sites. We have 38 robotic surgeons in the specialties of general, colorectal, urology, gynecology, gen-onc, and thoracic. With the transformation of our robotic program, we grew our robotic surgery cases from 1,293 in 2018 to 2,010 cases in 2019. And despite a slowdown with the COVID pandemic, we're on track to exceed that volume this year. We're at an Intuitive Enrich site, and the medical director of our robotics program is an Intuitive mentor surgeon for general and colorectal surgery. He performed his 1,000th robotic surgery case earlier this month. We've partnered with Intuitive to obtain robust data that drives decision-making. The growth and effectiveness of our program has been made possible by the acquisition and analysis of this data.
Susan, thank you very much. And last but not least, Dr. STONEMETZ.
Thank you. Really appreciate you having me on. I'm Jerry STONEMETZ. I'm the Medical Director of Perioperative Services at Johns Hopkins here in Baltimore. I've been in this role for a little over 3 years, actually almost 4 now. when I started, we actually had 4 robots. We had an XI and 3 X's. And at about the time I got into this position, we engaged with Intuitive on a new program where we've now increased the robots to 8 robots, 5 XIs, 3 X's, and an SP. We're doing over 5,000 robotic cases a year. In November, we celebrated our 10,000th robotic prostatectomy. The most expansive explosion in services that we've seen with the addition of these robots is in the field of foregut surgery. In our previous program, we just didn't have enough robots to go around, and now we have enough robots that these surgeons can actually get on them. And it was critical for us to do this to support our residency programs and all these specialties. It's a top-notch residency program, really can't survive without a robotic program to support it. And we're actually entering into this month putting a robot available for emergency use.
Thank you, Dr. STONEMETZ. I'm actually going to stay with you for a moment to get us started here with our conversation this morning. As an executive at your health system at Johns Hopkins, what metrics from your robotic service line are really the most important to you?
Well, unfortunately, Maryland is a bit of a unique state. It's the only state in the country that has somewhat fixed fees for hospital revenue. So unlike most hospitals, doing more surgery doesn't necessarily generate more revenue. We're under a fixed budget for the state. So we're very, very focused on cost per case and expenses. Now, robotic surgery, actually, if you look at it on the surface, it looks like it's going to be more expensive. But it turns out that in reality, if you look at the total cost of care, it's less. Our length of stays are less. Our outcomes are better. Our patients are better. And the total cost of care is going down in these specialties, which is what we really are focused on. Those are the primary things we're focused on at Hopkins.
Thank you. Okay, so cost per case is really the primary metric you're most interested in, which includes length of stay, of course, outcomes. I'm curious for your colleagues in Georgia, Kentucky, and Texas who don't have this fixed reimbursement model. Are there any other metrics or data points you would add to those that Dr. STONEMETZ shared as really pivotal to how you understand the success of your own respective programs?
Probably the only thing that I would add, I think most of the primary ones for our health system and our market in Texas have been touched on. I do think getting down to a more granular level is what we've been able to do at Methodist with the assistance of Intuitive, and start understanding OR time, the amount of time that more experienced surgeons with a robot are spending in the OR is less, the more they are exposed to the technology as opposed to more lower volume utilizers. And then one thing that is, I think, related to what a earlier panelist said during their introduction, being able to standardize our platform was a learning for us as well. So at my hospital alone, we had about a year and a half ago, 3 XIs and 1 SI. In the work we were able to do to standardize to 4 XIs now, and a single platform, and the supply savings that we have from such a standardization helped decrease our costs and helped the service line become more profitable.
Yeah, I would like to add on to that, Molly. I think, certainly the goal is to continue to push forward on clinical outcomes, data metrics, and I'll talk a little bit about that later on. But I think, early on, it's very much focused on volume related metrics, but also efficiency metrics. And so, to John's point, every minute you want to utilize that within the OR, particularly on these machines, since they're a fixed asset. And so the more minutes you can get on those machines, the more accessibility your surgeons will have, the better you're going to be able to utilize, and then ultimately you're going to be able to uh, justify the addition of more robots if needed. And so we look at that quite a bit. We look at first case on time starts. We look at on time starts. We look at turnaround time, not only from a room turnaround time, but from a physician turnaround time, and then prime time utilization. And so we look at that outside of just our main OR. We look at it specifically within our robotics center because it's our intention not only to drive a better utilization of those robots, but certainly physician satisfaction.
So this is Susan. Certainly we focus on the length of stay and cost, but in addition to that, we've been able to demonstrate a reduction in readmissions and a reduction in an improvement in our quality metrics. One thing that is interesting in our area, and I think this is through other parts of the country as well, is that we have an opioid crisis, and we've been able to demonstrate a reduction in the prescriptions of opioids with the use of the robot.
Fascinating. So really, I get a sense from even your geographic locations how various data points are more relevant to you given your patient population, your reimbursement models. Also, Matt, thank you for highlighting a long list of operational metrics. I want to stay with you a moment and follow up on that a bit more. As what you shared highlights, there is a wealth of information out there. So many data points you could encounter. I'm curious about what challenges or roadblocks you faced when it comes to obtaining actionable data. How do you get what you need, Matt?
So it's a great question, Molly. And I'll tell you, it's been an evolution. As I said at the beginning, we started 3 years ago. And at that point, it was really working with Intuitive to get whatever we could get off of the machine itself, right? There's metrics that we can gather off the machine, if it's volume-based metrics, if it's time utilization metrics. But we're part of the HCA Healthcare organization, and so we have access to a data warehouse enterprise-wide that's very helpful. But that said, it's only as helpful as the data that you put into it, and we're able to compare against other facilities. But to kind of go back to our challenges, it's really been trying to really push forward not only that volume-based metrics, but moving more operationally, efficiencies, and then certainly into the clinical data outcome that Susan mentioned. And that's probably been the largest challenge for us, and really just because of the complexity of that type of data, the manual nature of collecting that data. But we've been able to really widen our dashboard, and we have our robotics steering committee. We meet every month. It's led by one of our senior physician surgeons, who's a bariatric surgeon by training, and he really pushes us. He pushes us to look further into what more we can do, what more data we can get to be able to get to that granular level that allows us to make more informed decisions and certainly drive better outcomes. And so one of the things that specifically I've seen, particularly in bariatric surgery, because I think we're a little further down the line in that service line than any other, is that because we're a center of excellence from a bariatric surgical perspective, we already have the resources to mine that data. And so we've looked at not only length of stay, we look at readmission rates, we look at the use of enhanced surgical recovery programs, what percentage are we utilizing. We also look at reoperation rates. And with that, over the last 2 years, we have moved all of our bariatric surgeons onto the Intuitive Da Vinci platform. And they probably perform upwards of 95% of their cases on the XI. And with that, we've seen not only a 15% reduction in length of stay, but we've also seen about a 75% reduction in readmissions. And so using that type of data and being able to share that with a larger group of surgeons and caregivers that are looking at potentially moving into the robotically assisted world, that has been quite pivotal. And so, you know, overall, we want to continue to mature our dashboard, continue to feed our enterprise data warehouse, and allow us to compare not only at a service line perspective, but even at a surgeon level. And I think that in the world of healthcare, it's only going to push better outcomes.
Thank you. John, I want to check in with you. Does your organization, or do you have a dedicated data analyst or decision support role, or have you leveraged Intuitive's market access and custom analytics team, also known as MACA? How do you get a sense of data at your organization?
Well, so being a community-based health system, standalone health system, we consider ourselves fairly lean. I've found that most health systems probably consider themselves fairly lean. So if any of my colleagues are out there thinking, oh, great, where do we get this resource, right? There's these people within our health system that can pull this data and help it be meaningful. To your point, Molly, the MACA team, or the market access and custom analytics group out of Intuitive for Methodist has been extremely helpful. So we started our robotic steering committee at our hospital at Methodist Dallas, probably 5 or 6 years ago now at this point. But it was really roughly 3 years ago is when we started interfacing with the market analytics team to understand how do we get our data and make sense of our data. So we just utilized internal resources. So our corporate finance team, we interfaced with the Intuitive MACA team, and really the MACA team made it workable, right? It probably took us 6 months, and that's pretty fast for our health system to work through the logistics of how do we get the needed data out of our system to Intuitive. And then at that point, making sure that, we're crossing our T's and dotting our I's, that there is no patient health information that is being transmitted. It's only the financial data that will help us measure how we're performing, right? And where our opportunity is. So that was a learning for us, is working with MACA to then get data. And we're in process right now of going through our third or our fourth refresh of our data to get more recent data to the MACA team to see where our opportunities are. So I would suggest that if you believe you might not have the resources, I felt the same way, and Intuitive can be a great resource for you. I don't know that anyone so far has also mentioned the Genesis team. So the Genesis team has been very helpful for me at my hospital on more than one occasion, coming in and being with the frontline staff and working with the frontline staff and our physicians to make sure that we're being as efficient as possible in the operating room, to see if there's any waste in those areas as well that can really improve staff satisfaction. I mean, when the staff feels confident in what they're doing, when they're always learning, they feel valued when they see the Genesis team come in to work with them. Our physicians, and in Texas, a large number of our medical staff are independent physicians. They can go anywhere in the Dallas-Fort Worth Metroplex. And of course, we want them to come here. And so I learned when we engaged the Genesis team with them as well, that helps achieve making them see that we do value them. We say that we value them, but showing them that we value them by investing that resource and making sure our surgeons see that we're listening to them and their decisions, or they're part of the decision-making process. So between MACA and Genesis, Intuitive has been a great partner to help us understand data, get data, understand our data, make strategic decisions based upon that data, and kind of challenge ourselves, and then with Genesis become more efficient.
Terrific. So a multi-pronged approach really to making sense of this data. It sounds like you've seen results from several various components of the Intuitive team. But Susan, I want to also check in with you because, for those of you who have undergone a custom hospital analytics data sharing agreement with Intuitive for organizations that are lean, like John said, which is many, especially today, given the circumstances hospitals are operating under. What were your goals in doing so? And then also, can you tell us a bit about what that process looked like for St. Elizabeth, for others with us today who perhaps haven't had that experience but are curious what you went through and what that was like?
Absolutely. So when we were contemplating upgrading our robotic fleet, that was back in 2018, we entered in a data sharing agreement with Intuitive at that point. And they assisted us in comparing the cost, length of stay, readmissions, and complications of surgical procedures, either whether they were done open, laparoscopically, or robotically. The data was in an actionable format, and they provided us some direction and insight for some of our decision making. We would not have had the internal resources to do that analysis on our own. We initially leveraged that data to develop a business plan that justified upgrading our robotic fleet to 7 fourth-generation robots in 2018. And then we continue to use the data to demonstrate and validate the clinical effectiveness of our robotic program. Some of those things we talked about earlier from the cost and length of stay and quality perspective, and to drive some ongoing improvement efforts. Through our partnership, we're able to drill down to surgeon-specific data as well. We've utilized Intuitive's ecosystem of services. Genesis was mentioned earlier, to enhance the setup of our rooms, drives tray standardization, and reduce cost. Intuitive representatives have been a really strong resource in our staff training, and it's enabled us to have robotically trained staff 24 hours a day, 7 days a week. So surgeons can actually do robotic surgery when they're on call, at night, on weekends. And it's a huge satisfier for our surgeons, and it makes our robots be highly utilized. And then most recently, Intuitive's helped our team in compiling data for our Surgical Review Corporation Center of Excellence application.
Okay, so Susan, you just highlighted a few ways that I think the data you're seeing from the MACA team and Intuitive, it differs from a typical data pull. That is, it's more actionable, like you said. It can get down, you can drill down to specific surgeons for data points. Are there any other ways that the data you're looking at now differs from if you had been pulling it yourself that you feel are worth mentioning?
I think the biggest thing in most organizations, we just don't have the resources and time to pull the data and to look at it in a comparative manner to other programs. And so it's very, very helpful for us to kind of get direction in terms of what should this data look like? How can we compare it? How can we use it to take actions? And I mentioned earlier, our surgeons are very interested in this data. So for instance, they're looking at their consult time. We were able to put that time into our Epic, which is our EMR. And so that data is now in there for them to immediately see. We take a lot of the data that we have to our robotic steering committee that meets monthly, and that helps decision-making with that group. And I mentioned earlier the opioid crisis. So our surgeons became very interested in tracking that. And so we've been able to look at that resource as well. And it's been making a big difference in the number of prescriptions that are prescribed for various surgeries.
Perfect. And John, I'm going to turn over to you for one follow-up question here. And you had mentioned MACA made the data workable, is I think your exact phrasing there. I'm curious, by using data strategically, what are some of the initiatives that you've been able to put into place as a result of having this data at your fingertips?
Sure. No, great question. Really, I guess two things. So being a health system, and we have robots at 4 of our hospitals, it really helped us with systemness. I think that's something at Methodist Health System, as we're spread throughout a geography of Dallas-Fort Worth. It is a big area, but it's in a large population. But from a systemness standpoint, it probably doesn't make sense to duplicate things at at every hospital. And, as a hospital president, I'm okay with systemness as long as it's my hospital that gets to benefit. So I think, the data that we were able to get from through MACA really helped our system leadership work with all of us hospital presidents on strategically, where do we focus to continue to grow our robotic robotic service line. So as an example, we had made pretty good strides in with general surgery, of course, gynecology, urology. Earlier, I think Jerry mentioned foregut. We have a transplant program at Methodist Dallas. So 2 of our transplant surgeons really are at the front and the champions of our robotic program at our health system. So a lot of complex procedures. However, we did believe strategically there was opportunity to grow in gen oncology. And so the data has helped us make some strategic decisions about why we believe moving into the service line of gen oncology makes sense, how our outcomes in gen oncology compare to others across the nation as well. And then where does that gen oncologist go? Everyone probably knows that there's limited resources and limited physician supply in many cases. So the data has been very helpful in helping us plan strategically and launch a gen oncology robotics program at our health system.
Thank you, John. I see clearly. Thank you for the examples too. I think it looks like it's really made an impact in your strategic planning and even at the highest level with the executive team. So that's great to hear. Dr. STONEMETZ, I want to check in with you quickly. I'm curious about how you ensure progress on the opportunities you identify, like John just described, looking at the opportunities available for expansion of the program or new service lines, and what resources through Intuitive's ecosystem have you really tapped and leveraged to help you execute your goals?
Thank you. I think you're going to hear a lot of the same things from me. We've leaned heavily on the Genesis team to standardize training of our nurses for the 24/7. It's a real challenge to get these nurses who work mostly weekends to get them proficient and comfortable on a robotic platform. And so we lean pretty heavily on our Genesis team to help us with that, along with standardizing central sterile and supply chain. And also it was useful for them to come in and look at what we do with our cases. They actually have great visibility of other practices, and they actually had some great recommendations for our surgical technique to help cut down on the supplies that were used for every case. The MACA team has been really useful in getting us data. We do some data analysis here. I certainly wouldn't call Hopkins lean. But we also are pretty stretched on our resources. Lots of demand for people's time. So we lean pretty heavy on Intuitive to do some additional data analysis. And the piece that I personally like is the ability to benchmark, compare our data against other centers. We're seeing a pretty substantial expansion into these services. Transplant, trauma is doing a lot of their emergency cases now robotically. And we just want to keep a handle on the cost of supplies and the length of surgery, particularly with surgeons who are just starting. It's going to be important for us to kind of keep an eye on that, keep track of who's getting trained and who's getting access. I think the one area that I don't know, I wouldn't want to use the word struggling, but the word we need to do better, we're focused pretty heavily on, is making sure we have all these robots now. We got to make sure we're using them to their maximum capacity. And so we have a block model that allows surgeons to post into those rooms, and they're doing some non-robotic cases in those rooms. So we're trying to work with those services, feeding this information back to them in a very timely manner to really highlight the need to only use these cases, only do robotic cases in a robotic rooms. And that's a bit of a cultural change that we're dealing with here.
And Susan, let me open it up to you as well to join in here. If there's any other resources in the Intuitive ecosystem, Dr. STONEMETZ just mentioned Genesis again, Susan, like you did. also the comparative data, seeing where you stack up against others in the field. Are there any other resources that you feel are worth mentioning that have really moved the needle at your respective organizations in executing on your goals?
So one of the things is we do have a robotic steering committee that meets every other month. And there are members of that committee that are surgeons, anesthesiologists, our robotics coordinator, administration, quality, marketing team. And members of the Intuitive team are always present at that meeting. And they help guide us with our credentialing process that is very robust. Scheduling processes, as mentioned, that can be very challenging sometimes when you have surgeons that are doing some cases robotically and some not. Certainly the trade standardization and some ideas around marketing that we've used to market our services in the community. We've been able to attract new surgeons. So one of the big areas of growth for us has been in thoracic surgery, where we've seen a huge difference in the length of stay and outcomes. And so we now have 2 active thoracic surgeons and then one that is going to be coming that basically I think was attracted as a result of our ability to demonstrate the great outcomes.
Marketing resources, I imagine, are extremely helpful and valuable in shaping a message and getting it out there. Matt, any you wanted to mention before we open it up to questions from the attendees who are with us this morning?
I think that the panelists have done a tremendous job commenting. There's no silver bullet to this, and that data is extremely important, and the data is as good as what you can get out of the system and make of it. So certainly having the structure is key, but ultimately there are many institutions out there that may not have the necessary resources, and so leaning on Intuitive as a partner via MACA or Genesis is just so important. I think with regards to Genesis, we've had them on our site here now twice in the last couple of years, and we've learned a ton. But I think what also is cool about that is validating how far we've come. Again, our program has really been around for 2.5, 3 years, and we've accelerated. And I think data has been part of that. But ultimately, I think what's more important than just the data component is the buy-in and the structure and the rigor of not only your committee that we've all have in place, but the people and the professionals that are on that committee, and are they engaged in moving this program further, not just from a service line perspective, but also an outcome and quality measurement perspective, because I think it can make you a differentiator in the market. So I would say that, and then lastly, it's really getting the team excited. And I think if you have that coordinator and other members on your team, they feel part of something. But I'm just so proud of how far they've come along because of that team orientation, and to really use that data along with it and improve that to help us make decisions and achieve our overall objectives each year.
No, thank you each for painting such a rich picture of your evolutions, as like Matt said early on about using actionable data. So we do have a couple questions that have come in from attendees with us this morning. I'll state those, and then it's an open floor for whoever would like to chime in first. I think this first one will probably hint at some of the lessons learned over the years from all of you, but this attendee would like to know, where would you recommend starting if you haven't leveraged robotics program data much in the past? I'll open it up if you would like to each recommend a starting point or a best practice that this person keep in mind or acknowledge as they start out on this endeavor. And then hopefully there won't be any repeats. We can kind of go around and hear from each of you.
Hey, Molly, I'll say, don't do what I did. How's that for starters? So I think, all of our areas are highly competitive in all of our markets, I'm sure. But I think in the Dallas-Fort Worth market, I initially saw robotics maybe as a way to get more volume. And I think, not that that's bad necessarily, but I think what I learned over time was don't stray from what all of us probably know, regardless of how we got into healthcare, is it's all about the patient. Focus on quality outcomes. So robotics shouldn't be anything different. If there's a case that we can make to improve quality outcomes, to improve patient care, start there. That has to continue to be our true north. So that has to be your culture. And then I would suggest two more things is find a surgeon champion, find somebody. It could be one doctor, it could be a handful. I think in Methodist Dallas, as I think back 4 or 5 years ago in a Methodist health system, a lot of times it starts with that one person, that one surgeon who's passionate, who is passionate about improved quality of care. It doesn't matter if it was robotics or if it was some other patient outcome, they would be equally passionate, is find a surgeon or surgeon champions. And then lastly, partner with Intuitive. I think Intuitive's grown, I believe. I think the way that they partner with hospitals is excellent. I don't know that I felt that 10 years ago, 9 years ago when we started our program, but truly partner with Intuitive and they'll help your program grow.
So remember, it's all about the patient. Find a physician champion, which I want to circle back on in a moment, John, and hear more about that. And then third, partner with Intuitive. Susan, Matt, Dr. STONEMETZ, is there anything you would add to this running list?
Well, certainly, to start a robotics program, you're going to need to demonstrate that those outcomes of cost and length of stay, but the quality outcomes are what gets surgeons and other caregivers to buy into the program and to the value of robotics. And so that really does make a big, big difference. And it allows them to also demonstrate that, patients can go home sooner, patients can get back to their normal life sooner. And those are the things that are truly the long-term outcomes that we all want to achieve, when we're looking at a population health kind of a model. So I would start with those.
Yeah, the one thing I want to highlight is that I think you heard all of us talk about we have a robotic steering committee. You have to put together a robotic steering committee. And, to John's point, you have to find those enthusiasts, those evangelists surgeons who want to participate, but you need nursing, anesthesia, hospital administration, because they are the stakeholders that can help you get the changes when you get the data to present to them. So you got to start with a steering committee and then start looking at some basic efficiency metrics. One of the great success stories we had early in our program was we focused heavily on turnover times in the robotic rooms because we had a very expensive asset that we didn't want to set idle. And we were able to drop our turnover time substantially and maintain it in those robotic rooms. And it suddenly got every other surgeon going, I want that in my room. So the robotic service here at Hopkins has become known as really the premier surgical services because they seem to get they get team engagement, team involvement. The nurses are on board, anesthesia's on board, and it really becomes everybody wants to get on the platform now.
Okay, Matt, it's always the most challenging position to be in when you're last on a great panel. It's already shared a lot of insights. Anything you would like to add that hasn't been mentioned?
All I could do is just summarize what all three of them said. I mean, there's no silver bullet to it. You got to have enthusiasm. To drive enthusiasm, you got to make sure you got the right people on the team. And I think identifying that surgeon leader, and I've been with 4 facilities, 4 programs, and that has always been the most critical decision: is who's going to lead this program from a surgeon perspective. And I've been lucky and fortunate in all 4 times, and I have to tell you, I have the best right now. And I'll just call him out by name. Dr. Whipple is absolutely fantastic, and he inspires us. He drives us to be better. And when you have that, the energy in the room just grows and grows and grows. And so to add to what was said is just pick 3 things. Pick 3 things you want to focus in on. Make sure you have the capability from a technology perspective or a data capturing perspective to be able to measure and use that to build some momentum. And then as you start to move forward, add some other metrics to that. I would agree with Dr. STONEMETZ. The easiest ones to measure and track off the get-go are your efficiency metrics, and those are the ones that can have a ton of return, particularly when surgeons say, "Oh my goodness, you're turning around rooms in less than 20 minutes, and I'm over here doing lap, and it's turning around in 30 minutes. I want to get onto the robotic team." It changes behavior. That's the only thing I would add. That's probably just a summary of what everybody else just said.
Oh, thank you. This has been just a great conversation about how to get actionable data for effective care team coordination. As we wrap up today, let me turn it back over to each of you for about 30 seconds, a quick hot take with your final thoughts here as we conclude our panel. Dr. STONEMETZ, I'll ask you to begin.
Yeah, I'll have to admit it. So I'm an anesthesiologist by training. I'm not a surgeon, and I was not a robotic fan initially. I always thought it was an expensive tool, and I didn't really believe in it. But I've become a believer. I've seen what it's done here. Just as an example, I can't imagine having prostate surgery without the use of a robot. Hopkins has a great prostate surgery program, and we were transfusing about 20% of our open surgery cases. We're doing almost everything now robotically. We don't even do a type and screen on these patients anymore. I mean, it's so rare to transfuse them. I mean, just that one metric alone is uncomparable. And the most recent example, we had a lady who was a very sick patient, morbidly obese, with a very bad gallbladder, that the trauma surgeon did her robotically in the middle of the night, and it took them longer than it would have taken to do it openly. But that patient left the hospital in 2 days. And if they'd have done her under open surgery, she'd have had a hospitalization of at least 7 days. I mean, that kind of outcome is you just can't replicate that in any other platform.
Thank you, Dr. STONEMETZ. Susan, can I turn to you next for your final thoughts today?
Absolutely. I think Dr. STONEMETZ mentioned that, getting those great outcomes is what really makes their program grow in the end. When we have surgeons that are robotic surgeons, and then maybe their partners or other people in those specialties aren't doing surgery robotically. When they start seeing the change in the patient outcomes, that's when they are really bought into that robotics makes a difference. And that's what really buys the whole team. For instance, anesthesia, the nursing staff, everybody wants it to be better for the patient. And so those outcomes make all the difference in the world. And it helps you also justify your program in the organization.
Perfect. We'll move on to Matt for final thoughts and conclude with John. May I hand it off to you?
No, I thank you, Molly, for having us, and I appreciate the opportunity to share and talk about the program a little bit here at Memorial. I think, as I said, it's all about the patient, and through data, through all the structural things we've put into place, we've been able to show that we are providing better outcomes today than when we were 3 years ago, prior to the beginning of our robotics program. And so I would just say, make sure that you're utilizing your intuitive representatives. I think someone mentioned earlier, it's beyond any partnership I have with any third party outside of the hospital itself. And I think that's so important to bounce things off of them, leverage them in your committees, ask them for help. Because they have a lot of resources to provide, and ultimately they can help you look across a wider swath of organizations. And then lastly, if you're going to do it, go all the way. Pour yourself into it. Let the organization know why you're doing this. Help people understand the why, and then communicate and show the results. And I think you'll be very happy with the outcomes.
Thanks, Matt. And finally, John.
And there was almost one thing left to say, and then Matt took it. So I'd say, to try to summarize, don't give up. and go and see are the two final things that come to my mind. So don't give up, establish your cadence. You've heard several times the monthly robotic steering committee meetings that are, it sounds like maybe all of us are having at our health systems. Partner with Intuitive, make sure you have staff and surgeons involved. They need to be at the table. They need to be driving this. And then lastly, go and see. So I was surprised how much I learned and how much benefit I've had when you go and see the robot in action. We have a dual console in a couple of our rooms, so to be able to be there, be around our surgeons, be around our staff, show them by physically being present that a leader of the hospital supports them, adds to the ability for the team to not give up whenever tough times are encountered, because that will happen, right? There's going to be times when any process, project, service line gets difficult. And for the staff and your medical staff to know that they have your support by you going out and watching them and being around them is important.
Thank you. Well, Dr. STONEMETZ, Matt, Susan, John, I want to thank each of you for bringing all your insight to this panel conversation today. Attendees, we hope you got something out of it, some insights and also some action items wherever you are in the maturity of your robotic program and data analytics. So attendees, we are going to take a short break before we start our next session at 10:50 Pacific Standard Time. So we'll see you then. And again, to my panelists, thank you so much today for making this such a robust discussion.
Thanks for having us.